Hi, everyone, and welcome to another episode of The Doctor is In. I'm Dr. Freddie Gomez, and we hope that here on the show we can provide you with the virtual care you need during these unusual times. We've learned over the last few months that common symptoms of the COVID-19 infection includes a sore throat, a dry cough, and fever. Some even experience body pains and difficulty in breathing. And while these symptoms tend to last for a few weeks, the impact they leave on one's body could last for much longer. Today, we look at the possible long term effects of this disease, especially on the lungs and the brain. We have with us today Dr. Luis Martin Habana. He's the division head for critical care medicine at the Philippine Heart Center and the Heart Institute at Chinese General Hospital and Medical Center. Thank you for joining us, Dr. Habana.
Yes, good afternoon, Dr. Freddie.
Now, a lot of us have become familiar with the symptoms of COVID 19 and the safety precautions taken to fight and hopefully avoid it. However, we are still discovering what happens after the infection has left the body. Doctor, with what we know now, what are the possible long term effects of COVID 19?
Well, at this point in time, this disease is actually still an evolving disease. A lot of what we know now, we did not know 5, 6 months ago. But especially in terms of long-term effects, I think there are a few studies that have been started and a few small studies that have shown persistent symptoms long-term, even after patients have been documented to recover. Um, in fact, there was one report this week from the Centers for Disease Control in the Mortality and Morbidity Weekly Report, which came out this week. Up to 35% of patients who have recovered 2 to 3 weeks later still reported symptoms. And most of these were fatigue, difficulty in breathing, headache. Another report coming out from Italy mentions that the symptoms could persist even up to 60 days after the patients have recovered. And most of the symptoms that were reported were difficulty in breathing and fatigue. So I think the implication in patients who develop this kind of infection are still not quite clear, especially long term, what will happen in terms of the course of this disease.
Now, we mentioned earlier some of the symptoms of COVID 19, which can be classified based on their severity. Can long term effects of COVID 19, like what you mentioned, the fatigue and all these things, occur in those with mild or moderate symptoms lang?
That's a good question. Um, in the report from the Centers for Disease Control in the US, the data that they actually cited were in patients who were mild, who did not need hospitalization. And even in patients who did not require hospitalization, 35% of them still complained of symptoms 2 to 3 weeks later. And in that particular report, less than 34-year-old patients, 1 out of 5 actually still continued to report some symptoms 2 to 3 weeks later. Now, in the Italian study, which I think included 143 patients, even after 60 days, roughly around 44.1% reported that their quality of life deteriorated significantly before they got sick. At least one symptom was present, I think, in 1/3 of the patients, even after 60 days. Now, this is only for patients with mild disease. What more with patients who are severe or those who ended up on a ventilator? Definitely the long term effects, even without COVID, even with patients with pneumonia who end up on a ventilator, they actually continue to develop long term effects even up to a year after their ICU stay. And these effects are not only physical, they're also mental and psychological. A lot of these patients develop post-traumatic stress disorder. Some of them develop depression. Some of them develop anxiety. Some of them actually develop a lot of stress. A lot of them also do not or unable to return back to work, which is important because the more patients who end up with this kind of disease, not all of them who have recovered from the disease might be able to go back to work. Some continue to report being disabled or unable to even perform activities of daily living or even continuing to care for themselves. So I think for the severe patients, for those who end up on a ventilator in an ICU setting, the long-term consequences are significant compared to the mild or even the asymptomatic
That's right.
positive patient.
That's right. So just to remind our viewers, napaka-importante po na hindi po tayo ng COVID-19, ng coronavirus na ito, kahit na sa tingin nyo, malakas ang resistensya nyo at kaya-kaya nyong lampasan ng COVID-19, you do not want to be infected even at all. These mild symptoms, which Dr. Habana has been mentioning, ito po yung 2-week home self-quarantine ang kailangan. So we even see long-term effects even with these mild symptoms. Okay, so now let's take a look at our social media questions. We have a lot coming in. We have one from Susan. Let's read her question. Do we know why COVID-19 triggers recurring health complications when other viruses do not?
That's actually a good question because we still do not know one thing with this kind of infection. I think one of the greatest concerns is, can you be reinfected after you have recovered from COVID-19? And I think there are some isolated reports already. There was one isolated report in Italy of a patient who got initially infected in March and then got reinfected by the end of April. There's actually a concern on whether the reinfection, if it ever occurs, is much, much more worse compared to the initial infection. So I think we shouldn't be complacent, even if you develop COVID-19 and it's only mild or you are asymptomatic. I think we should still be protecting ourselves by practicing what is recommended by our agencies, because we still do not know if ever we get reinfected, will it be worse compared to the initial infection? We also do not know how come some patients do not develop symptoms. How come some patients develop severe symptoms? So it's quite very difficult to understand virus. And I think we are still all learning from this. We still do not have all the answers. So it's still evolving. And I think the best advice is to continue to keep our guard up and not to get infected at all.
That's right. And thank you for that question, Susan. And it will take more time to fully understand the effects of COVID-19. When we return, we'll take a closer look at how destructive this virus can be, leaving long-term effects even after recovery. You're watching The Doctor's In. We'll be right back. Welcome back, everyone. You're watching The Doctor is In. And we're still here with Dr. Luis Martin Habana, who specializes in adult intensive care. Now, Dr. Habana, we know that COVID-19 primarily attacks the lungs. Sa simula pa lang, nakita natin kung paano nito naapektuhan ang baga ng mga tao. But Doctor, how can COVID-19 permanently damage the lungs? Is this possible? Katulad po ba to, Doctor, ng let's say, for example, ang pulmonary tuberculosis na someone who recovers from TB, maaaring magkaroon ng lamat or peklat sa baga na nakikita ito several years, even sa x-ray, kahit na gumaling na siya. Ganito rin ba ang COVID-19 kung umatake ng baga?
You're correct, no, Dr. Freddie. the lungs actually can be affected in a couple of ways. One is if the virus directly invades the epithelial lining, which is yung cells that line the air sacs and the airways. Second is it also affects the lining of the blood vessels, especially the small blood vessels, supplying blood flow to the air sacs. As you know, the lungs are sila yung in charge ng gas exchange. Kaya lang one of the problems with COVID-19 or the virus is that it can actually potentially cause the blood to become more predisposed to clotting. And they have seen actually what we call pulmonary embolism occurring in patients who have died from COVID. These blood vessels which go into these air sacs get clogged with blood clots. So what happens is even if their air sacs are ventilated with oxygen and air, the blood cannot get the oxygen when they pass through the air sacs. So that's one mechanism. And then the other mechanism is there are some changes that are seen that persist even after the patients have recovered, especially on when they check the CT scan. Some of these patients develop fibrosis. Eventually, the ability of the lungs to expand is compromised. The lungs become stiffer, and that limits the ability of the patient eventually to be able to breathe properly, especially when they exercise or when they do physical activity. So I agree with you.
Okay, that's good to
Yes.
yes, that's good to note, doctor. That it affects someone who has recovered even for the long term, even for the quality of life of the patient. What does it look like after this? Let's say, for example, bigyan natin ng example natin mga viewers. Let's say, for example, an average male or female who is athletic in their 30s is able, let's say, to run or jog 3 times a week for parang isang oras straight. Magagawa niya pa ba ito easily kapag nag-recover siya with COVID-19 at may mga effects na ganito sa baga niya?
Yeah, that's a good question. Um, there are actually examples that we can use, no? Like, for example, in the United States, professional sports has come back. And surprisingly, these professional athletes, some of them have been discovered to have COVID-19. And a few of them have been documented to have some involvement of their heart, preventing them from going back to their sport. There's some reported cases. There's one case who was a professional diver who actually did not have any disease before he developed COVID. And after recovering from COVID, continued to have problems as far as pulmonary function, yung ability to breathe, even after recovering from COVID. So it doesn't mean that if you do not have any disease when you acquired COVID, even if you're young, that you will not be able to develop long-term effects because of the infection. There are known cases of young individuals, even professional athletes, who develop continuing symptoms even after they have recovered. I think the important thing is if you get admitted, especially if you get admitted and you're very, very sick, you still need to follow up and you still need to ask the doctor whether you can go back to your previous level of activities, especially if you want to engage back into sports. I think for the heart, they have come up with recommendations on how to test patients, especially those who have developed heart involvement when they were sick in the ICU or in the hospital. And there are some tests that are suggested that be done when they go back to their physical activities.
That's right. So
And
those who use sport as their form of livelihood, COVID-19 infection can actually be career altering. So best is to avoid this and do all the precautionary measures to avoid getting infected with COVID-19. Now let's answer the social media questions that have been pouring in. We have one from France. Ang tanong ni France, when a person is put under intensive care due to COVID-19, does it also affect his or her mental health?
Yes, definitely. You can just imagine, try to close your eyes and then try to listen to all the sounds in an ICU. Staying in an ICU is actually not natural. All the sounds that you will hear would be beeps, alarms. Sometimes you cannot move because sometimes you are restrained. Sometimes you are given sedation. If you have a breathing tube, you cannot talk. It's so hard to communicate. And majority of these patients continue to develop mental issues even after they have recovered, especially when they stayed in the ICU. There have been documentation that even later on, they have problems with memory, they have problems with cognition, meaning their ability to do some simple mental tasks. Like if you need to analyze a problem or if you need to compute, sometimes it affects their ability to do that. Sometimes their mind is muddled so that they can't even go back to their regular work because these effects linger. Now, especially in the patients who end up in the ICU who develop a stroke, as you all know, stroke is also one of the manifestations that COVID-19 can present with. The lingering effects post-stroke can also persist, which can also be disabling. So I totally agree that the mental effects last even after you are discharged, especially after you stay in the ICU.
Maraming salamat, Dr. Luis Martin Habana, for helping us answer these very important questions. Let's take another break, but when we return, we will discuss the possible long-term effects of COVID-19 on the brain right here on The Doctor's In. Welcome back to The Doctor's In, and thank you for joining us today as we talk about the long term effects of COVID 19. Recent reports have shown people who have recovered from COVID 19 as having difficulty with their balance, forgetting little things like appointments or where they place their keys, or simple arithmetic problems seem to be difficult now. This has prompted further investigation on how COVID 19 may have an effect on the brain. We're here with neurologist Dr. Alejandro Diaz. He is the section chief of neurology at the University of Santo Tomas Hospital. Good to have you once again, Doc Bimbo.
Hi, magandang hapon. Not so good weather here in our place. Can you hear me?
Yeah, I hope it'll get better anytime soon. Now, doctor,
Right.
as we all know, COVID-19 is a respiratory disease that can potentially damage the lungs. Kanina pinag-usapan natin kung ano ang mga pangmatagalang epekto nito sa baga o lungs ng mga tao. Pero doctor, we've heard reports of of some symptoms that may lead to think that the COVID-19 also has an effect, permanent effects or lasting effects on the brain. Can you talk more about this?
Yeah. Uh, we thought neurologists in the early months that most of the effect of COVID-19 in the brain is acute. So that is with regards to delirium, encephalopathy, stroke. But there were reports now in the New England Journal of Medicine, as well as in the Lancet, that there seems to be an increasing awareness by the neurologists of seeing new problems that seems to develop subacutely over the long term that affects the brain, mainly associated with problems in memories, cognitive abilities, decision making, and attention span.
Now, Doctor, there's been studies on microstrokes as the cause for these at least partly the cause for these neurological symptoms after recovering from COVID-19. Is it possible to avoid or even at least minimize these effects for those who are recovering or who have recovered from COVID-19?
That's a hard question. We still don't know much of what's this going, the long-term effect of COVID-19. As we are seeing in the literature, it seems to be that even those with mild respiratory complications due to COVID-19, some of them manifested with neurologic manifestations. So there seems to be no direct correlation between the two. Now, it is true that the one of the pathologic findings is that there seems to be an involvement of the small blood vessels inside the brain that also are vulnerable to small clots, okay, that can produce actually micro strokes. No, either the strokes can be big if it occurs in the large vessel occlusion or thrombosis or embolism, but they can likewise also produce microthrombosis involving the small blood vessels. And we know that the cerebral blood vessels inside the brain are small blood vessels. So some of the pathological findings, they have found that there seems to be some pathologic changes referable to small infarcts that affects the cortex or even the brainstem as reported.
Okay, now let's answer some questions from our viewers asked through the CNN Philippines Facebook page. Itong unang tanong natin ay galing kay Jing. Ang tanong ni Jing, what is the treatment or management available if someone exhibits neurological symptoms of COVID-19?
Actually, there's no proven treatment yet for COVID-19 except probably for dexamethasone. Among those that needs a ventilator or high oxygen requirement, and probably remdesivir. We're not sure about that. Okay, and as you know, even the tocilizumab came negative in the clinical trial. So I think the most that can I give
Sorry,
from
doctor.
those who
Sorry
consult
to
with me are mostly supportive, actually, supportive treatment. Meaning to say treat the symptom
right.
of the patient.
I think doctor, the question was referring to Right. Sorry to disrupt your answer, doctor, but I think the question was referring to the neurological symptoms. Anong pwedeng gawin kapag meron ng mga neurological symptoms ang pasyente na may COVID-19?
Well, if it is an acute, for example, the patient comes in COVID-19 positive and he develops or she develops a stroke, I think it's very important that they should not stay home. Ang problema kasi, natatakot silang pumunta sa emergency room. So anyone with a symptom of stroke, and that is basically facial droop, arm drip, kung bumabagsak ang mahinang kamay, or may numbness or slurring by speech, till proven otherwise, this is a neurologic manifestation or symptom of stroke. So they should not actually waste any time, and they should rush kagad to the hospital emergency room. Because of the emergency room, we are now following the protected code stroke. Ibig sabihin, hindi na katulad doon na pagdaan mo na, diretso ka kagad sa scan. Sisiguraduhin ng mga emergency room physicians, residents, and neurology residents that before they approach you, they have to be properly wearing their PPE, following the proper code strokes, the mask and everything. And this really can take some delay of about 5 to 10 minutes. And then you have to be brought down to the CAT scan or the MRI laboratory to undergo tests so that they will know whether is this stroke secondary to ischemic stroke, which is nagbarang ugat, wherein the patient can receive, if within the needed time, the window of time of 4.5 hours, they can be given RTPA or thrombolysis. Or in some centers where they're capable, they can even remove the clot through what we call mechanical thrombectomy. And if it is a hemorrhagic stroke, the moment that the patient is seen in the CT scan with hemorrhage, agad-agad, we tell the resident to give tranexamic acid, okay? Because we know that if you give tranexamic acid in the very early stage, you can actually help stop the enlargement of the hemorrhage, which is the one that makes it actually fatal.
Okay.
Of course, the giving of early bundle of care management, blood pressure, and neuroprotective agent may also help in the recovery of the patient. Now, in those
Right.
that manifest with peripheral
Very
neuropathy, like Guillain-Barré syndrome, for example, they can also be treated with the usual treatment that we give,
okay.
like immunotherapy such as IVIG.
I'm sorry,
for
doctor.
example.
I'll have to cut you off there. I'm sorry to cut you off, doctor, but we are pressed for time. Thank you very much for joining us. Marami pa talaga tayong kailangan alamin, and we thank doctors like you who are there to answer those questions, especially now na may neurological symptoms na possible for COVID-19. So thank you very much, Dr. Alejandro Diaz, for sharing
All
your
the time.
insights on this topic. And thank you also to our viewers for watching. We hope we were able to answer some of your questions about COVID-19. Remember, the best way to avoid infection is to practice proper social distancing, washing of hands, and wearing of masks. I'm Dr. Freddie Gomez, and I'll see you again on Monday, 3:30 p.m. on The Doctor is In. Stay safe, everyone.